surveys. Now, surveys have lots of uses. Again, they're very much a descriptive type of study. You're not particularly doing anything, you're observing the real world. They can be surveys of physiotherapists, PTs. They can be surveys conducted on the general population. They can be of patients. And for instance, you could talk about, well, how do PTs classify low back pain patients? And you could take 100 PTs and see how they classify, what classifications that they fit into. You could take a bunch of patients and you could describe their gender and their age and their particular clinical features. You could talk about the survey of the general population and how many of them report low back pain, and how many of those in the general population who report low back pain seek help from a GP or from a physiotherapist. So there's lots of types of surveys that can be done, and they are descriptive, but they give a very useful background information about whatever that topic happens to be. So it's a way to understand the real world, is I guess a way of saying it. There are obviously problems, as with all research, how much we can trust their findings. The particular problems, and actually these apply to lots of research, but it's about how is that sample obtained, and about the non-response rate, and about who are the participants. And obviously, ideally, you want the sample to be as random as possible, as opposed to a convenient sample. The more convenient the sample is, the less robust has been the gathering method there. Non-response rate in these kind of things is a problem. You can never avoid it completely, but we want to try to get as many people as possible. And also in terms of, you want to know who is in that sample, there should be some description, however basic, of who are the participants who are involved. There is, though, some element that the reader is going to have to make a judgment about those issues in terms of the robustness of any sample that is used.